question I get is, should I have my child wearing ankle braces when they participate in sport? And there's really two scenarios to talk about. The first scenario is an easy one. If your child is recovering from an injury and or has had a previous injury to that same ankle, they should not only be wearing a brace for high-risk sport activity, but they should also be engaged in a physical therapy rehabilitative type program. The second scenario is a little more tricky. That's the scenario where the athlete has never had an injury and you're trying to prevent that first injury or first sprain to the ankle. Previously, most of the studies showed that you typically wouldn't recommend bracing for those kids. However, there's some new data in the school-age population which suggests that even bracing a child who's never had an injury may decrease their risk of that first ankle sprain. It really boils down to an individual decision in those cases, meaning if your child seems to have weak ankles, has turned them in the past without injury, that may be a situation where you want to brace that child. There's no convincing evidence saying that bracing weakens the ankle. The take-home message on this, as long as your child is engaged in some regular strength, conditioning, and a balance training program for their ankle, if you want to add the addition of the brace for prevention, that's certainly appropriate.